right, guys, in this lesson, we're going to talk about putting in an IV in combative patients. Now, combative patients from the very beginning are always something that drove me a little bit into some anxiety about having to deal with them, and then I get an order for an IV. So let's think about this. What should we do when we're doing IVs in combative patients? Number one, the first thing we want to do is think about patient and nurse safety. You should never assume that you can talk a combative patient into compliance. You want to try to put them in a position where they feel comfortable and that they'll be cooperative, but you also have to understand that you will need to get help. It's nearly impossible to try to put in an IV in a patient that's going to be maybe swinging at you. Even if they have restraints, you potentially could harm the patient, or you put yourself at a disadvantage of maybe an accidental needle stick. This is where people get hurt. This is where patients are potentially injured. So always get help. If you need 2 or 3 nurses, that's totally okay. What you also want to do, what you want to think about when you're putting in IVs in combative patients is, if your patient is potentially going to have a restraint, whether it's a posy or whether it's wrists, or whether it's some sort of maybe if it's an elbow immobilizer. If it's an elbow immobilizer, that thing goes above and below the elbow, so an AC would be a terrible spot to put this in. Now, if I've got a patient that has wrist restraints, trying to put a hand IV in, or where it ends right at the wrist or just right above the wrist, maybe that's a bad area. You want to avoid those areas of restraint, because all you're going to do is your patient's going to dislocate that IV, and now you got to go put another one in. You got to get a bunch of people involved, but that's just something to consider. Now, the last thing you want to do is de-escalate and try to calm your patient. I said that you can't always get them to, you can't always coerce your patient into being completely compliant, but one thing you can do is de-escalate your patient. You can talk in a calm voice, you can be positive, you can try to positively reward them, but what you can't do is ever try to get a patient to completely comply. So what you need to do is just try to de-escalate, talk in a calm manner, and try to get your patient as cooperative as possible. Sometimes there's a little bit of bargaining, sometimes there's a little bit of negotiation in terms of getting that going, but do what you can to get your patient calm. And also think about this too, is that multiple people could actually make the problem worse. So you want to try to find the minimum. Maybe it's just one other nurse you need. Maybe it's one nurse, maybe it's 2 nurses, maybe you need one that's going to distract them and one to hold to help restrain them. There's lots of different ways to do it, but try to get your patient in that most calm state before you even try to do this IV. All right, so let's talk about your IV insertion. You want to set up that routine that we always talk about when we're doing IVs. We want to get all of our supplies. We want to get everything, and we want to set it up. That's the most important 2 things that we got to do. You got to have a good foundation. If I'm trying to reach across the bed and there's stuff just flying everywhere, then it's no good. Get your bedside table, get it all set up, and identify your vein, and then you want to apply the tourniquet like we always do. This is where your friends are going to come in, your coworkers or your other floor nurses. This is where you're going to get them to come in and help you. The other thing you want to do is right about in here, you also want to get restraints. And by restraints, I mean help. This is what I mean. I don't mean like wrist restraints. What I want is help. I want people to get in there and help me. Before, I need to make sure that I can at least stabilize the location that I'm going to apply this catheter in, and then we can move forward and actually placing it. But if I don't have a solid footing, it's like trying to shoot a cannon out of a canoe. There's no solid foundation. So getting everything in place, getting everything as calm as possible, getting my friends there to help me calm the patient and keep that arm or leg stable wherever we're going to go. But that's going to be another solid point that you need to think about. Get that IV placed and also secure it. And this may take a couple of different methods. You may have to do tape and transparent dressing, and you may have to do a couple of different things. But these are things that I want you to think about, is you got to think a couple steps ahead for these types of patients. Here you can see that we've got a combative patient who's not cooperating. The important thing here is that we want to use those restraints if we have an order for them. We want to make sure we're following policy. But the biggest thing here is we've got additional nurses and additional staff at the bedside to make sure that the patient is going to cooperate. The goal here is to maximize stability for that IV insertion site. Here, what they're doing is they're actually keeping the patient in a relaxed position as much as possible, even though he looks pretty uncomfortable. But the goal here is, again, to stabilize that area and to keep the patient from having his arm flail about to where they could actually cause injury. The process is still the same. You're still going to prep, you're still going to set up, you're still going to place that IV in the exact way that it needs to be placed. You're going to follow all the securing techniques. You're going to make sure that it's secure. But the biggest thing you want to focus on here is avoiding areas that are going to create problems. You want to make sure that IV is going to stay in place and patent. So we're going to want to avoid areas like the elbow or areas like the wrist, especially if there's wrist restraints or if there has to be an elbow immobilizer, making sure all the lines are away from the patient so that you don't run into any complications with that IV. All right, now let's recap. Remember, the first thing we want to do anytime we're dealing with combative patients is to get help. We want to focus on safety, both of the nurse and of the patient. We don't want accidental needle stick injuries. We don't want to cause harm to our patients. We don't want to injure our patients. We don't want to have to put in more IVs than necessary because we actually didn't do the due diligence in getting some help. Maybe it's one nurse, maybe it's two nurses. Maybe you just need one to talk to the patient, or maybe you need that right nurse to talk to the patient to get them to cooperate. It's not always cookie cutter, and you may need to approach this in several different ways, but always think about safety first for your patient and for yourself, and then avoid those restraint areas. So areas like the wrist, you don't want the IV to get caught in wrist restraints. You want to be able to, if you need some sort of elbow immobilizer, you want to make sure that that's not going to cause any problems with any sort of IVs. The last thing you want to do is be giving your patient some sort of medication that extravasates and causes soft tissue necrosis or damage because we put it in maybe a bad location. So always think about if some sort of restraint is going to cause damage to the IV to where it's not patent and it's not working. Now, last thing, de-escalate. Try to calm the patient to improve the cooperation in what you can. Once you get to that point, then you can focus on stabilizing the patient, that IV location, so that you can get that IV set. All right, guys, I hope that this lesson has been helpful in giving you some tips and tricks on how to approach combative patients and how to get those IVs set in them so that you can have better success and your patients can have more positive patient outcomes. Now, we love you guys. Go out and be your best selves today. And as always, happy nursing.